Hello, my name is Jasmine Arvizu, and my PANTHER ID is 5715572. I grew up being surrounded by the medical field since both of my parents were medics in the Army. When I was at a young age, my mom decided to pursue a career in nursing, and my childhood consisted of visiting her at the hospital and seeing all of the amazing things she did as a nurse. From then on, I decided that I wanted to be like my mom and choose a career that revolved around helping others and giving back. But it wasn't until I was much older and my dad decided to become a nurse that I could truly understand the kind of impact a nurse could have on their patients and their families. I have been listening to my dad's stories and tidbits all my life, and I want to give patients and their families not just exceptional care as a nurse, but I want to leave a lasting impression on them just like they do, and make it known that nursing is not just a job, it is a lifestyle. And I want to give patients and their families the care and companionship that I know my parents have been giving them over the years. This past summer, I volunteered at a hospice center, and it introduced me to one of the most difficult hardships I think I will encounter as a nurse, which is the idea of death and dying. I believe that this experience made me realize that dying is a part of life, and to approach it in a way that normalizes it in a sense. The best thing you can do for a patient and their family in a time of need is to just be there for them and listen when they need you. From all of my parents' stories, I have learned that as a nurse, and even just as a person, the most important thing you can do for someone is to listen. I think listening skills are one of the most vital parts of being a nurse, and it is difficult to learn and teach good listening skills. But I have learned that even just being there for someone and letting them talk without saying anything can be the most important and helpful thing for someone. Patients might be a small part of a nurse's life and job, but as a nurse, you have the ability to be a large part in a patient's life. And I want to do my very best as a nurse and as a friend. Ever since I took an interest in the nursing field, it has always been a dream of mine to work with my parents one day. I have always been interested in psychology, and ultimately, I would love to combine my psychology degree with my nursing career. Along with psychology, I have also taken an interest in the hospice specialty since volunteering with the hospice organization over summer. I think psychiatry and hospice are two specialties in nursing that are often misunderstood and less recognized than other specialties. I want to make mental disorders more recognized and normalized as physical disorders, and I also want to own a hospice practice of my own with my parents that is on or near the beach. The beach has always been a favorite place of mine, and I think it is a great place to be near to heal. I am fortunate enough to be surrounded by my two parents as an amazing support system and as mentors for my future career in nursing. My ultimate goal as a nurse is to use the knowledge they have given me all my life, along with all the things that I will learn and experience as a nurse, to make many small impacts on many people that will leave a large impact on the nursing community. Thank you.